the Johannesburg Labour Court has ruled that community healthcare workers should be made permanent. It's a victory for workers after the National Health and Allied Workers Union represented those 50,000 community healthcare workers whose recurring fixed-term contracts denied them obvious job security that comes with permanent employment. Let's get you some reaction now. We're joined by Mike Shingange, who is Nehawu's president. Mike, it's great to have you with us on the program. Thanks very much indeed. So 50,000 people affected by this decision. How long had they been working on recurring contracts as opposed to permanent contracts?
Good afternoon, Michelle, and thanks for having us. It has been a very long time. In fact, some of them have even had to exit the services after having worked for about 20 years or so without any benefit. I mean, they've got nothing to show for all those years that they've rendered themselves to the public service in the form of the Department of Health. But there was a union who have been in the battle for the absorption of these workers since way back 2012, when they were still employed by various entities contracted to the Department of Health. Others have been having fixed contracts that were recurring from time to time. We managed in 2018 to get them into a system of a PESAL, wherein a resolution was agreed that we will then work on absorbing them permanently in the Department of Health. Of course, typical of our state, the department will have reneged for a long time. We went to the system, to the Bargaining Council for arbitration, up until this court case that we have had now. So they have been long, and we want to welcome it, and we say that to those who stood behind us and fought very hard, it's a victory that is sweet for them. However, there are a few things that are still outstanding that we need to finalize with the department in as far as their conditions is concerned. Now that their contract has been deemed to be that one of permanent.
Yeah, we'll get to those issues that still need to be fulfilled in a moment, Mike. But I want to reflect for a moment on, those healthcare workers, those community healthcare workers who, as you say, worked in the system for many, many years, some of them 20 years or even more, not being able to reap the benefits of this kind of decision. I suppose it's a bittersweet victory.
Well, it is, although it came too late for those who have already existed the system. But it is for these ones here, but it's also the victory for those who are going to come. That never again we shall have any worker performing a public health care services in the department or in our society, but not being employed by the Department of Health. It's actually unethical. It's unthinkable that you can have somebody touching patients, somebody working in the communities, somebody going door to door, administering medications on behalf of the Department of Health, but not employed by the Department of Health.
Yeah.
These workers, as the court will have said, the task that they perform is a task that you at no point are going to wish it away. It's a permanent task. It's going to be important to be needed going forward, including when we talk about the national health insurance, including when we talk about the primary health care. These are the backbone of the re-engineering of the primary health care. So without this cohort of the public servants, you're not going to succeed in your mandate. So indeed, it's a victory for them. Unfortunately, some of them could no longer benefit because they've already existed in the system.
And I suppose just for a moment, Mike, can we remind our viewers about the role that these 50,000 community healthcare workers play in our communities?
Yes, these are the people who go house to house, provide, sometimes they bath patients, sometimes they ensure that patients take their medication, particularly those who are chronic, those who can no longer walk and go to school. Those are the people who goes to the hospital. Those are the people who go to community and do what we call health education, that they educate people about prevention. That's why we say they are a backbone of the primary health care. These are the people who work with what we call a ward-based health care, a team that has got a doctor, supposed to have a pharmacy assistant or a pharmacist, have got a nurse. Then you must also have these ones. These are the people who sometimes just walk without any transportation, and they are being paid stipends by either NGO or by some funder that the government will have enlisted at that particular time. And these people are also found in the clinics, and sometimes are found in hospitals like that. They're actually assisting the chronic shortage that we have now of healthcare workers across the land that bread, including at the level of nurses or assistant nurse for that matter.
Yeah. So
during
Mike,
the COVID-19, these are the people that during
yeah,
the COVID-19
yeah.
had to ensure that there's cleanliness in their community, and the people who needed to ensure that people are washing their hands, they are taking all the medication, they are putting all the necessary protection. They were actually the ones who were flooding communities and also doing the testing and screening. When we talked about screening and testing during COVID-19, that massive testing screening was actually done by the community health care workers.
Yeah, at great risk to themselves. Gosh, how easy we move on from something like a pandemic. It seems to have slipped my mind for just a second there. But yeah, they would have been the backbone of government's response during the pandemic.
Correct.
So you talked to us earlier about the issues that still need to be resolved insofar as these permanent contracts are concerned. What are those issues?
Well, remember, they are earning a stipend now, except apart from the fact that they do have personal number that we managed to secure for them in 2018 in that resolution. But we still need to determine the entry level. At what level are they going to be remunerated? We still need to determine their salary bracket. We still need to determine the conditions. Remember, currently, they are not getting medical aid, they are not getting pensions, they don't have pensions, they are not having leave days. All those conditions of service that are accrued to any public servant, those are the things that we need to, after having a discussion with the Department of Health, then we're going to move into the bargaining council to ensure that we secure their conditions of services so that they are as equal or at the benefit as any other public service benefit who is performing public administration on behalf of government.
And do you think there will be a back and forth there between what's expected by Nehawu and your members versus what government is willing to offer?
Well, we will be surprised that there will be an attempt to do a back and forth. But I must say that the last engagement we had, even when the case was still waiting for the outcome of the judge, we were finding each other at the level of the political level with the Department of Health. Because on one hand, this dispute arose in the bargaining council. That's why we went to go to the arbitration and then later to Labour Court. But we have since found each other that we will probably, we are hopeful that we're going to do what the court says we must do. In any case, the department will have already started doing something with their provinces, profiling these people according to their skills, according to their age, so that if and when the budget comes, they can absorb them, even not as community care workers, but in other categories of employment, because they appreciate and recognize the services that they have sacrificed for a long time in the department, including the fact that you can't do away with the services. We don't wish that there should be back and forth, but because there are other departments that are involved, DPSA, including Treasury, perhaps that's where we can find a snag. But as far as the Department of Health is concerned, we have been having a discussion for as long as it will have taken many years up to this level. We hope that we're going to be able to move forward with them.
Mike Shingange, let me thank you for your time this afternoon. Great to talk to you, the president of the National Education, Health and Allied Workers Union, and a victory there for community healthcare workers after that decision by the Labour Court that those 50,000 workers must be made permanent.